Okay, hello everyone. My name is Sarah Sharifi, and I'm a sponsorship coordinator for PUM's Toronto board. Before I introduce our speaker, I just wanted to review some guidelines for everyone to follow throughout the webinar. Everyone is expected to use their full name as a display name. Everyone must keep their cameras off. And if you have any relevant questions, directly message them to Lena through the Zoom chat function. So at the end of our speaker's webinar, Lena will be reading out as many of your questions as possible. And remember to stay till the end to find out who won our Chipotle giveaway. So this month's theme is pharmacology, and today PUMP is so excited to welcome our professional in this field, Pauline Ball. So just to quickly introduce Pauline, she is currently a hospital pharmacy resident at Trillium Health Partners. She was heavily involved in leadership positions in school, including being the vice president of the Society of Pharmacy Students. And she also worked in Sudbury, Ontario at Health Sciences North in her final year of rotations. Now, she worked in a variety of unique rotations, including HIV, chronic pain, and antibiotic stewardship. Post-graduation, Pauline continued to work at Health Sciences North as an oncology pharmacist. Now, before we start with the presentation, I just wanted to give a big thanks on behalf of the PUMP team to Pauline for participating. We're so thrilled to have you here today. Pauline, take it away.
Can you guys hear me okay?
Yeah.
Yes? Okay, awesome. Okay, well, thank you so much, guys, for having me present. So I'll just get right into the presentation. My goal for this presentation is to really kind of help guide you in deciding whether becoming a pharmacist is the right choice for you. So, if this will work, sorry. There we go. Okay, so just a few learning objectives. The first one is to gain an understanding of a pharmacist's roles and responsibilities. Then we'll talk a little bit about the differences between the University of Waterloo and the University of Toronto Schools of Pharmacy. I'm focusing on these two schools of pharmacy just because they're the only two that we have in Ontario. There are 10 pharmacy schools across Canada, so I encourage you guys to look into those if you're interested in kind of going out of province. But just for the interest of time, we'll focus on those. We'll also discuss a program called the Conditional Mission of Pharmacy program. It's specifically at the University of Waterloo, but I'd imagine that quite a few of you are grade 12 students. So this program is very timely for you to apply to. And then lastly, we'll just talk about a few tips to make yourself an ideal candidate for pharmacy school. So a little bit about my educational background. I did do this Conditional Mission of Pharmacy program way back in 2013. So I can talk a little bit about my own personal experiences if anybody has any questions about that. But as a part of this program, I did start at the University of Waterloo in their undergrad of science program, doing an honor science degree. After 2 years, I started at the University of Waterloo School of Pharmacy. So this is a picture of my class back in 2016 at our white coat ceremony. A white coat ceremony just symbolizes the journey, the start of your journey. So by giving you a white coat, so many other professions do this as well. This is just our class. And then fast forward 4 years, a very quick 4 years, and then we are graduated. So this is a picture of the same class, but now wearing our black graduation gowns. Okay. I just wanted to preface this presentation just by saying that my experience is mainly related to the University of Waterloo, just because that's all that I've ever known. I have many friends that have gone to the University of Toronto, so I can answer some of your questions if you're interested in applying there. And then in terms of my work experience and my background, I am primarily a hospital pharmacist, but I have worked in community practice. I have worked in a family health team, and I've worked in a few specialized pharmacies as well. And most of my training background is in oncology. Okie dokie. So the first thing I wanted to ask you guys is, when I say what does a pharmacist do, I think unfortunately quite a few of our minds probably turn to the fact that pharmacists count pills. And it's really no fault of our own. I think that's just how generally pharmacists are depicted. And most of the time, the pharmacists that you commonly see are the ones that are, pharmacists that work in small independent pharmacies or work for Shoppers or Rexall or larger chain pharmacies. But I just wanted to say that pharmacy is not counting pills. I think that's like less than 2% of what we do on a daily basis. A pharmacist's role is much more clinical. I agree that maybe back 100 years ago that we did probably count pills, but since then our scope has expanded so much. So my hope with this presentation is to give you a better idea of what a pharmacist does. So if we look at the next slide, this picture is more what I imagine when I think pharmacy practice. And I'll go through each of these pictures in depth to kind of share with you the main avenues that you could go down with your pharmacy degree. So let's start with a picture in the very center. So the picture in the center, you have a pharmacist speaking to an older couple. This picture I've used to represent community pharmacists. And a community pharmacist is a pharmacist that you would typically see at like a Shoppers Drug Mart or a Rexall, just to give you an example. Their role is super clinical. They are kind of like a jack of all trades. And they're not really working with acute conditions. They tend to work with patients who have more chronic conditions, who aren't acute, who are coming in just getting like their regular medications filled. But you do need to have quite a good knowledge and a strong knowledge of a variety of different disease states. So you can answer everybody's questions because you're not really specializing in one area. You kind of have to know everything because literally anything can show up at your pharmacy counter. This role is super rewarding. It's great if you really like to interact with patients. It's also a great avenue to go down if you've ever wanted to own your own pharmacy, if you ever wanted to be a business owner, because being a community pharmacist, you can definitely be a manager, or you could purchase your own pharmacy and start your own business that way. So that's a little bit about a community pharmacist role. If we start at the picture at the top left, you have a woman there and she's kind of working with a computer. This is what I imagine an industry pharmacist role to be. So an industry pharmacist, they kind of work with primarily with pharmaceutical companies. So your role after you graduate pharmacy school could, really doesn't have to involve any patient care at all. You could be a pharmacist that primarily works with pharmaceutical companies, like an industry pharmacist. And in that role, you really wouldn't see very many patients. I have a friend who's an industry pharmacist and she's working from home right now with COVID. So that's the picture that I thought of when I put that up on the screen. I thought of her working away at her laptop. An industry pharmacist role is very project-based. You're kind of working with government, you're working with pharmaceutical companies to kind of bring medications to the market. Being a pharmacist, you have a unique knowledge of pharmacotherapy, so you know how drugs work. You also have a healthcare background, so you know how patients would probably take those medications. At the same time, you do learn some government policy and health policy throughout school. So you do have a really unique perspective that you can bring towards these pharmaceutical companies and government policy and government. So that is one avenue if you're more interested in kind of working behind the scenes. And then if you look right beside that picture, you see a bunch of scientists kind of working away at a microscope. That is a picture I'm going to use to represent research. So research is a really important area of pharmacy as well. I know many students that finish pharmacy school and they decide to pursue a Master's of Science or they decide to do a PhD. And primarily what they're doing through that Master's of Science or a PhD is research. You can also do research throughout school. There are many electives that you can take in pharmacy school that give you hands-on research experience. And even in your undergrad degree, before you start at pharmacy school, you can, start looking into research with certain professors. But research is really important, and it is an area that quite a few grads decide to go down. So if you're not really interested in patient care, you're not really into working with projects, you like to work more with your hands, you want to create something, then maybe gearing your degree towards a research background would be more so for you. And then if you look at the bottom picture there right underneath where you see a professor and everyone's kind of raising their hands, that's the picture that I've used to represent academia. So after you finish your degree, you can decide to, teach at the pharmacy school. You can teach for other professional backgrounds as well. Sometimes there's classes that you could teach for pharmacy technicians. at particular colleges. So you could kind of go ahead and do that. You can work at the same faculty that you graduated from. This role is a little bit longer. It's a little bit harder to get to academia. You do need to have some extra training and education after your degree, but it's super fulfilling. So that's one avenue that you could go down as well. And the picture to the left of that is a picture where you see some medical professionals talking to a patient. And that's the picture that I've used to represent hospital pharmacy. So hospital pharmacy is primarily where I practice. And hospital pharmacy is very clinical as well. More so, I think, than a community practice. And in hospital, it's very different because you're dealing with sicker patients, people who have more acute issues. So your role is you have to be much quicker on your feet. You don't see your patients for very long, so you don't have as much patient interaction as you would in community practice. In community practice, you kind of know your patients for life. You see the same people every single time they come to the pharmacy. They know you, you know them by name. In hospital practice, you see somebody and 2 days later, they're well enough to go home and they're gone. So it's a much faster pace, but I would say that it's a really rewarding experience because you get to work with a medical team. So I work quite often with, physicians, for example, nurses, nurse practitioners. So it's a really team-oriented environment. And it's a really rewarding practice. So those are a few general avenues that you can go down with your degree. Even I've only put 5 pictures up here, and they're just kind of very broad pictures of what you could do with your degree, but there's so much that you can do with your pharmacy degree. You can become an entrepreneur, not just opening your own pharmacy, but you can decide to do something, totally off the wall with your degree. I'll give you an example. So one of an alumni who's a couple of years older than me and graduated a couple of years sooner, she actually opened up her own company, and her company creates the booking system for people who are getting flu shots right now. And she signed with Rexall. So she's doing quite well for herself. There's also consultant pharmacists. So you can kind of offer your services to people who are opening their pharmacies. So you don't have to open your own, but if you have that expertise, you can advise them. And you can be your own boss, really. There's also telepharmacy now. So there's pharmacists who primarily work from home. They work virtually even before COVID. And they provide services to people who live in really remote areas. And they talk to them through the camera and they answer their questions that way. And it's just the tip of the iceberg. I mean, if you can imagine it, you can do it. A pharmacy degree can either be a direct pathway to becoming a pharmacist, if that's what you want, or it can be a stepping stone to step into something else. So hopefully that was a little bit more helpful, but we definitely do not count pills all day. Our role is much more clinical than that. Okay, so just to give you an example of some of the things that you could do with your degree, here's a slide that I stole from the Canadian Pharmacy Association website. And this kind of shows you a pharmacist's scope of practice in Canada. So you see all your provinces and territories listed out there. If it's green, that means we can do it. If it's yellow, that means the government's thinking about allowing us to do it. And if it's red, it means that we can't do it at all. So as you can see, at the very first one, we can prescribe drugs. So that means that just like a doctor can write a prescription for us, we can write a prescription for our patients as well. Alberta can do pretty much everything on this list. So they're a really great province to practice in. So if you really want to practice to your fullest scope as soon as possible, then Alberta would be kind of the direction that you would like to go in. But with that being said, other provinces are catching up. If you look at Ontario, you'll see that we can prescribe for minor ailments and conditions. We have a yellow box. So that means we're currently in the process of negotiating with the government so that we can prescribe for minor ailments. And minor ailments they're not really minor, but it's just conditions that people commonly can experience. So I'll give you guys an example, like maybe heartburn. So if you have a patient who's having heartburn, rather than having that patient, wait a couple of weeks to get an appointment with their family physician, or having that patient go to the emergency room and wait for hours and hours, a pharmacist can see that patient, diagnose that patient, prescribe them a treatment, and then fill that medication for them, counsel them on the medication, tell them how to take it, what to expect with it, how it's going to feel, follow up with them, make sure that they're doing okay. So you pretty much have a full circle of care in your pharmacy. So we can already do that in Ontario, specifically for patients who want to stop smoking. We can prescribe medications for them. And there's other really amazing things that you can do as well, like inject vaccines, which most pharmacies are doing now. You can also inject not just vaccinations for the flu, but you can also inject, travel vaccinations. So if you have a patient who's going to be traveling, you can counsel them on what to look out for and give them a vaccination, get them ready for their trip. You can order lab tests in certain provinces. So lots of amazing things. And I only expect this chart to become more green as the months and years go on. So by the time you guys get into pharmacy school or you graduate, this should look very, very different. And the way that you're trained in pharmacy school is not to just kind of focus on drugs. You're trained on how to look at someone and diagnose their signs and symptoms. You figure out what kind of disease they have. You go through all the treatment options. So you're trained. You're fully prepared is what I'm trying to say. You're fully prepared to be able to do this. So when you graduate, you guys should be able to diagnose and treat somebody just as a physician would. So a little bit about why I chose pharmacy. I lucked out. I found a pharmacy in my community who was willing to take me on and allow me to volunteer with them. And I started doing that in 10th grade, so a super long time ago. But I really enjoyed my placement with them. And I just thought like I could see myself doing this for the rest of my life. So that was one big reason, is that I had tried it out and I liked it. I loved interacting with patients. I like to work as a part of a team, which is why I kind of geared my career towards hospital pharmacy, because that's where I found that I was the happiest. And I also knew that, just like I showed you guys that picture with all the different avenues that you could go down, that there's so many different practice areas that I could get into, and some that I hadn't even thought of or imagined way back in high school. So I knew that there's a lot that I could do with my degree. And back in high school, I didn't have it all figured out either. I knew I wanted to go to pharmacy school. I just didn't know what I wanted to do with my degree. So I liked that I had a lot of choice. And in pharmacy, as well as any medical profession, you're going to be constantly having to train yourself and constantly have to teach yourself, because information is always changing. New information is always going to be coming out. So I like the fact that you're always a continuous learner. So things that I would repeat doing in pharmacy school. So I was very heavily involved in extracurricular activities, which I loved and enjoyed. And I encourage all of you guys to do that, not just in pharmacy school, but start now. I also, having gone to the University of Waterloo, we are the only cooperative or co-op school in all of Canada. So we have the opportunity to work while we're going through school on certain rotations and get paid for it. And when I was choosing these co-op jobs, I would always pick something unique, something I hadn't done before, something that I thought was interesting. And I kind of thought about like the logistics of it later. So if this was super far away, I didn't really care. I just kind of went for it. And I encourage you guys to do the same. Choose experiences that are going to help you grow as a pharmacist, and then kind of worry about the logistics later. Same goes for rotation sites. And rotation sites are clinical practice sites that you have to do to graduate. You're not paid for those, but they're still really rewarding patient care experiences. When you guys get to university, you'll realize that bursaries and grants are super important, because you get like a little bit of extra money in your pocket that you don't have to pay back. So continue to apply for those. But I also want to encourage you guys to apply for awards. So even if you think that I'm not deserving of this award or I'm not going to get this award, apply for it, because you'll surprise yourself, and awards are a great way to boost your resume. So that's something to look out for once you start school. Most universities have like an awards page that you can apply for under your faculty. And then throughout school, another thing I did was I networked with upperclassmen, alumni, and faculty. I talked to a lot of people. I reached out to people. I would message people and just introduce myself and say, hey, if I ever have any questions, can I reach out to you? I think that's a great way to know someone. It's a great way for them to get to know you. And pharmacy is a very small world. I'm always amazed at how small it is because it doesn't feel like it could be so small, but truly, if you know one person, you have a mutual friend somewhere. So getting an in with an upperclassman or an alumni or a faculty can really help progress you and your career forward. So we'll talk a little bit about the two schools in Ontario. So you have the University of Waterloo and the University of Toronto. So they're a tiny bit different, and things have changed this year because of COVID. So I'll talk a little bit about that as well. And at the University of Waterloo, you have 120 seats in pharmacy school. 25 of these seats are reserved for those CAP students that I mentioned before. In Toronto, it's a much larger school. Still relatively small compared to some of the university classes that I'm sure you guys will be sitting in very soon. Some of those classes can be like 1,000 people. So Toronto is smaller than that, but a little bit larger at 240 seats. You need a 75% average at the minimum to get into Waterloo, and a 70% average with Toronto. These are minimum averages, so it's enough to get your application in the door. However, I would encourage you guys to aim for as high of an average that you can achieve to remain competitive. Waterloo does do a test. So when you apply and you're successful in getting an interview, you'll also have to do a fundamental skills assessment. In this skills assessment, you're graded on reading, writing, and math, just basic math skills. And you do it on usually the same day of your interview. Toronto used to have a test called a PCAT, which is, where you're tested on things like physics, math, science, just very general science courses, as well as I think a little bit of reading and writing. But because of COVID, that test has actually now been removed, and I don't think they're going to be bringing it back. So that's actually a good thing. So now in Toronto, you don't have to do the PCAT anymore. Waterloo and Toronto are both now asking for a test called CASPER. CASPER is an interpersonal assessment. So it's not really grading you on like numbers or writing or anything. It's grading you on your personality. So they'll ask you ethical questions and you'll have to answer those ethical questions, and that gives them an insight into your personality. Waterloo does ask for a reference letter, whereas Toronto does not, and they're both a virtual interview now. So I don't know if that's going to change by the time you guys get into applying to pharmacy schools, but for now, I think that's the direction that they're going down. So a little bit about this Conditional Mission to Pharmacy program. So the Conditional Mission to Pharmacy program is for high school students. So for those of you who are in grade 12, or those of you who are in younger high school years and are thinking about applying to pharmacy, the Conditional Mission of Pharmacy is a status. It's not really a program. And essentially what it does is it gives you a seat in pharmacy school right out of high school. So somebody takes your name, in your, like hypothetically, they take your name and they write it on a chair, just to give you an example, and that is your seat. So that's your seat. As long as you meet certain requirements, you will get your seat, which is a good thing because when you're applying to pharmacy school, the situation on the left is happening. When you're applying just generally with everybody else, you're fighting for the same seat. Whereas when you're applying through CAP, you have that seat, you're just making sure that you get there. So it's a little bit easier. CAP students also have some perks in the sense that you already are affiliated with the School of Pharmacy. You get to go to their events, you get to know the faculty a little bit sooner. You get to do some practice tests for that fundamental skills assessment, which is very helpful when you're applying to pharmacy school because you still have to apply to pharmacy school. It's the same steps. It's just a little bit easier because you have some more perks. And I'll give you another example. When we were talking over here about the minimum average, let's say you apply through CAP, you apply with a 76% or whatever, you're in, you met that requirement. But if you're applying with everybody else, you need to be competitive. So sometimes, applying with like a 76%, if everybody else around you is applying with an 80%, it can be harder to stay competitive. So the CAP status kind of takes out a bit of that stress. So you do need a high school admission average of 90% or greater. You do need to show that you have some leadership, community involvement, and if preferably you have some pharmacy experience, either working or as a volunteer. You have to show that you're interested in the profession. So you do that through an application form. And then you also have to provide 2 letters of reference. So one is an academic one, and then you have one from maybe an employer or a volunteer agency. And then when you guys apply to university, you go through OUAC, and you would apply to the University of Waterloo. You would pick a science program, one of these 3, and you would also pick the CAP status application. And you guys have a lot of time. It's coming up in February 1st of 2021 is the next deadline. So if you're in grade 12 now and you're serious about applying for pharmacy school, I would look into that, because I think it's a very reassuring thing to have. But even if you aren't thinking about it right now, you're not really sure which direction you want to go in, that's totally okay too. It's nice to have, but it's not a requirement. And once again, the majority of students get into pharmacy school without CAP. So here are a few tips that I wrote down that will help you become an ideal candidate. So the first is if to truly determine if you like pharmacy, the best thing to do is to get some experience in it. So volunteer or working is better because you get paid for it, but volunteering is also a great option. This can be really difficult though, because pharmacies are always a little bit worried about liability insurance. So when you're an employee with someone, you're already covered. You have insurance that's protecting you because you're an employee. But when you're a volunteer, you don't have any insurance. So if you make a mistake, there's nothing to back you up. Your foot in the door with pharmacies to volunteer. I mentioned before that I really lucked out and got a volunteer placement, but I applied to literally every pharmacy in my hometown, and only one called me back. So it can be really difficult, and I'm sure COVID has not helped that situation. It's probably just made it a lot worse. So if you cannot get pharmacy experience, the next best thing is you can ask to mentor or shadow pharmacists. So maybe if they can't offer you a position, you could, ask, hey, can I watch you for an hour? Can I hang out with you for an hour? Can we go out to lunch together? Whatever the case may be, speak to different pharmacists in different practice areas, ask to set up a phone call with them, a Zoom call, email them back and forth. It costs nothing to ask them to give some insight into their profession and their experiences. But it gives you so much value because that you can talk about those experiences in your application. And when you show the initiative that you care so much about the profession, or you care enough about your career that you've reached out to X amount of pharmacists and you have this information, it makes you a stronger applicant and candidate. The other thing too is to get involved in extracurriculars and leadership roles. It's really important to have some kind of leadership or extracurricular experience on your applications because it'll make you a standout candidate. Getting leadership positions is very difficult. I've been there, I know. You're competing against a lot of people for one position, so it can be really hard to get your foot in the door there too. So what I say to that is if you're having a difficult time getting into certain extracurriculars, or you can't get a leadership position in a club that you really wanted to, create your own club, create your own fundraiser, your own organization, your own company even. Just create anything on your own because that shows that really stands out on application. So sometimes you just need to create your own opportunities. So I would kind of brainstorm things that you're interested in and, just go for it, just start it. It might start small, but in a couple of years, maybe it'll pick up and become something really huge, and it gives you something to talk about in your application. And lastly, it's really important to stay up to date on what's happening in the pharmacy profession. I mentioned before that we're working with the government to get some legislation so that we can prescribe for minor ailment conditions. That's going to change, and hopefully that we get to do it. But things like that are always going to be happening in the profession. So keep up to date on it, because not only does it inform you a bit better about the profession, and you can still decide if that's something that you would want to get into, but it also helps in your interviews, because they will ask you questions about pharmacy practice, and it's good to have an idea of what's happening. And if you work and volunteer in a pharmacy, you might already kind of have that background knowledge, but if you don't, you can get that information from Google, you can get it from CNN, from literally anywhere. Okay, so that was my presentation. Thank you so much for your time, guys, and I can take any questions now.
Now, before we dive into the questions, thank you, Pauline, for that very insightful presentation. And now for viewers, I hope you remember that we have a giveaway for this webinar. And calling all Chipotle lovers, 2 lucky winners will each receive a dinner for 4 from Chipotle. And our winners are Tiffany Lai and Alain Lai. And please contact us at the email sent in the chat to claim your prize. Now on to Lena for the next section of this webinar.
We will now move into the Q&A session. Many of these came from the sign-up form, but please message me any more questions that you would like to ask. Starting off with the first question, Pauline, what obstacles did you have to face throughout your career, and how did you surpass them?
Okay, that's a very broad question. Thank you for that question. I think one thing I struggled with throughout pharmacy school is because I was so involved, I was always trying to juggle schoolwork and extracurricular work. And I think it's super, you might hear when you guys go to university that C's get degrees, which is true to an extent, that, if you pass with a certain average, that you will get a degree at the end of it. I think it's always important to strive for higher marks sometimes, just because you don't know where your path is going to take you. And sometimes if you decide to do further education after pharmacy school or university in general, you're going to need to have competitive averages to apply for those programs. So I think that's one thing I should have probably done a little bit better, is study a little bit more during school and not waste my time kind of dabbling in so many different clubs, and kind of narrow my passions down a bit further. So hopefully that answers your question a little bit. I think that's a question more personal to me. But I think if you're struggling with something throughout school, or you're having an obstacle, there are so many people out there to support you, and you should just reach out and ask for help. I mean, most schools have counselors. So if you're struggling with some mental health issues, they're there to help you out. If you need help with schoolwork, you have TAs or teaching assistants, and you have office hours with your professors that you can reach out to and go to. So yeah, I hope that helps a little bit.
That was a very insightful answer. Moving on to our next question. What are the steps to specialize in oncology pharmacy?
Okay, good question. So oncology pharmacy, there's no clear way to get into it. I think it's really specific on kind of your path and just the opportunities that come to you. If oncology pharmacy is something that you want to do right out of the gate, then you can always choose to gear your rotation experiences or your co-op experiences in oncology, so you can start building up that background. If your school offers an oncology elective, you can take that elective. You do learn a little bit about oncology in your regular curriculum, but it's not in depth. So if there is an elective that goes more in depth, you can kind of choose to participate in that class. There are also organizations. There's one called the Canadian Association of Pharmacy in Oncology, called CAPHO, and they have courses for pharmacists who are practicing oncology or want to specialize in it. So you can do some extra courses after you graduate, and you can kind of get that oncology certification, which will help in getting jobs in oncology. My pathway to oncology was just it just happened. I asked to work at the hospital that I had done my rotations at because I really loved my experience there. And they just gave me the choice. Do you want to work in oncology or do you want to work in medicine? And I had never worked in oncology before, but I chose to do oncology because it's a really unique practice area. So it just kind of happened for me, and it can happen, just kind of happen for you too. But if that's something you're gunning for, then you can kind of aim your experiences that way. Another thing you can do is there is something called a pharmacy residency. So you can apply for that after you finish pharmacy school, and it gives you whatever hospital you're applying to, they might have an oncology center, so you can kind of gear, once again, your electives towards that. But once you graduate with that residency certificate, it's easier for you to get into hospitals that have oncology practice.
That was a wonderful answer. Bring me to my next question. What inspires you to become an oncology pharmacist?
Yeah, I just kind of, like I mentioned before, it just kind of happened. And I chose it because it was something that I was interested in. And during school, you have very few electives, I found. I decided to take a research elective, so I didn't get a chance to take the oncology elective, but I knew some of my friends did. So I just decided, like, I don't know when I'm ever going to get the chance to practice in this again. And I just went for it. So having done oncology, though, I can say that it is incredibly rewarding. You are dealing with patients who are going through, very difficult times in their lives. So the way that you counsel patients is very different from how you would counsel patients in other practice areas. You tend to have to be a bit more empathetic to their situation. And it's a really interesting area as well. Sometimes things just, like the way diseases present themselves is very different. Your patients who have cancer tend to be sicker, so it can be a challenging area. So those are just a couple of things that I love about it.
Did you do research in undergrad? And if so, how did you get the opportunity?
I did not do any research in undergrad, but I do know friends that have. And some of the things that they did was you can reach out to professors directly. So let's say you really like your biology prof, and most professors, pretty much all of them, have to do research to be professors at universities. So you can ask to be a part of their, do research with them. So you can find the supervisor that you want and kind of fill in the other steps a little bit later. And you can also ask to be or apply to be a teaching assistant. Once you get your foot in the door with teaching assistant, sometimes that can help get you research positions as well, because you get to know the profs a bit more closely. And then I think it's dependent on the university as well, but I think there are summer programs that you can do in research. If you just find those opportunities, you can kind of search for them. If there's a particular university that you're looking for, I would reach out to their faculty or their science advisor and ask if there's how you can get started in research.
Great answer. So our next question is, if you have CAP status and change your mind about applying to pharmacy school, what would be the consequences, or what would happen?
So let's say you apply to CAP and you decide you don't want to go to pharmacy, really nothing, there are no consequences. You can change direction anytime. I don't know the exact process of what would happen to your tuition and stuff. I think you probably wouldn't get a refund, but you can drop out of pharmacy school and you can pursue something else if you wanted to. And same with CAP, it's just a status. I know some friends who did CAP status and they decided that because they live in Toronto, they wanted to be closer to Toronto. So they applied to the University of Toronto Pharmacy School and the University of Waterloo. And once they got into the University of Toronto Pharmacy School, they decided to go that way. So I know some friends that even if they had CAP, they decided to go to a different pharmacy school. I know some friends who decided after their first or second year university that pharmacy wasn't for them and they found a different passion. So they just, instead of applying to pharmacy school, they just went to a different direction. You still have to apply to pharmacy school through CAP. It's not like you automatically get in. There are requirements. So you have to apply pharmacy school just like everybody else. You have to submit the same application forms. You have to meet the same average requirements. You have to show that you have 500 volunteer hours or something in pharmacy. I forget the exact number. It might have changed now. But if you choose not to do those things, that's okay too. It's just a status. It's not a program.
And this brings us to our last question. How do you manage stress, and how did you study when you were studying pharmacy?
Okay, that's a great question. The way I manage stress, for me personally, I think all of my friends were going through the same thing at the same time. So we purposely made a point to hang out at least once a week. And I've always lived with roommates and also as a, what do they call them? Are they residents? Yeah, I think so. Like when you join like a housing unit or something at university. I'm blanking on the name, but there's always people around me. So we always made a point to hang out together, and sometimes we study together. And if somebody's feeling down, you have like a support system around you. And I think that's key for, any university or any program that you're going to. Unfortunately, professional programs, medical, healthcare, any kind of program in healthcare is hard. And you're definitely going to feel like there's going to be some days where you feel a little bit defeated. So it's important to have a strong support system and to make friends with people who are going through the same experience as you. We always made a point to like take a break from studying and hang out together and just like laugh. And I think getting sleep is super important. I know sometimes like you throw sleep out the window when you have so many things to study for, but sleeping and eating well and exercising are key because they keep you sane. And how did I study in pharmacy school? I think it's different for everybody. I know a lot of people who had like PDFs, so they would just write on the PDFs. I personally would download everything in a PowerPoint slide, and then I would just type literally everything my professor was saying in like the chat little section at the bottom, and I would study those. Sometimes you can ask your professors if they'd be comfortable with you recording them. Some professors are okay with it, others are not, and you have to get permission beforehand. But if you're a verbal learner, you can like listen to those lectures over and over again in your through like your, I don't know, your iPhone or whatever. I had a friend who commuted to and from school, so she would drive like an hour and a half one way and an hour and a half back the other way, and she would just play the lectures in her car instead of the radio, and that was a really great way for her to study. When you get to pharmacy school, there are usually a couple mentorship programs, so you can like pair up with somebody who's in upper year, and so it's a great way for you to kind of figure out how they studied. And sometimes certain classes are not your textbook university classes where you're listening to a professor talk. Sometimes you're doing group work. Some classes are teach yourself kind of classes. So I think everybody's situation will be a little bit different, but you can kind of figure out some of those pieces once you get there, or you can ask some of your friends and colleagues around you to see how they're studying.
That was a really helpful and informative answer. So that about wraps up our Q&A session and this webinar. Make sure to sign up for our next pharmacy webinar on November 28th with student Mara Fagioni. Mara will focus more on her journey as a current student working towards becoming a pharmacist, and this will include more details on admissions and how to prepare for high school and university for a career in pharmacy. Thank you all for joining us today, and have a great night.